Welcome back to 25 and Beyond, Karen Yours Silver Jubilee podcast series. Over the last two episodes, we've had our pharmacy leaders, Anwar and Shabir, share their journey with us. They've also been sharing how we engaged our customers. Today, we're going to look at something else, how we have had to change the way we have been engaging our employees and how the changing regulations in the state of Qatar has been changing. So let's jump back into the conversation. Welcome back.
Thank
Thank
you.
you.
How are you doing today?
Fine, fine.
Good.
All good? All right. So tell me, guys. I've been listening to all the challenges that you've gone through, how you've worked together. I'm sure, when a project has been done, when you've surpassed that challenge, it is easy for people to, burn out from the stress, from the pressure, even daily pressure, attending a lot of customers and listening to problems and trying to help them. It must be, your energy will go down, your battery will run out at some point. So, in this case, how do you manage the team morale and how do you bring them back? How do you bring their battery back up?
See, if the engagement will be a concern if we are focusing on a management style that is focused on certain people. So what we did back in 2017 and 16, we started forming small working groups. Whenever we have some reasons or some challenges or some project, we form small working groups, and working groups started working. So the entire idea is decentralized, and the process is taken care by different people. So when more people are involved, the message of the idea will spread across the team, and there will be the most of the team members will get the message that this is what we are going to do and this is the reason why we are doing, and then it is easy to make people convinced what we are going to do. Once we have a convinced group of people, it's easy to make them engaged. In professional way, we did that one and we had enjoyed benefit of it. And in other way, when COVID and the other situations came, the things totally changed, and everyone limited into their own self. And the people in we are the only healthcare professionals in the healthcare chain who had interacted with people without knowing this person is infected or not infected. Other than, in other words, we can say that it is in emergency departments, might be, but in inpatient, all other, because the first thing the healthcare facilities they do test, but in a pharmacy, nobody. It's not only in Karanka pharmacy, in entire world it was a situation. So the stress and anxiety might go up, and immediately after the COVID restrictions are slowly started relaxed, we came up with it also. It is not from us. The area managers and the pharmacy in charges, they proposed us that we should do something to make the people engaged, and we should have a situation that people are interacting and people are coming together and enjoying, relaxing it. So we just set up a team again. That is not from our side, it is from the team. We set up a team and they proposed an activity that was around 2 month long activities, and that was the one of the events, Caring Cure pharmacy retail chain, one of the best events. People are even, you might have heard about it.
I have heard
People
about
are
it. I was not even attended. It
people,
looks like I missed something big.
yes, people are still talking about, and that the team worked behind it. I still remember that was Salahuddin was one of our pharmacist in charge. He was the convener for that committee, and they did a wonderful job because now, still after 3-4 years, people are talking about this. Means they made a big impact. So this is how we keep our team engaged. And when we talk about customer engagement, and I just missed one event because we started celebrating the Pharmacist Day when it was just a poster in Facebook. So we initiated having some CPD programs for the pharmacists and having a separate event for the pharmacists of care and cure, and recognizing them and inviting multiple stakeholders from HMC, from Qatar University, and from the community pharmacy field to come together and share their informations and knowledge and refresh at the same time to remind them that we are integral part of the healthcare system. So this is we started. I think before we started, I didn't see much people, much groups or pharmacy groups are celebrating. Not only pharmacist group or pharmacist groups also were not celebrating by that time. So this is then every year when this September come, people started asking me what is our program for this year. So this is how people think that this is an activity that every year we must continue. This is what the message I am taking from it, because they are waiting. Because when there is a Pharmacist Day, people are thinking, yeah, Kerangure, or we will be having some event for the pharmacists. No, this is an event exclusively for the pharmacists, and you do it. Our chairman and the management team addresses that. The one thing I just wanted to emphasize here, that when in certain occasions chairman may be out of country, he is more than happy to join us, at least through an online link and Zoom call or a Microsoft Google Meet or anywhere. He will make sure that he is part of the celebration, and he himself be proud that he also a pharmacist. If a person become an entrepreneur of the same his own profession, that is more close to him, so that we always enjoy and we always get benefited out of this point, that he know what is our need and he know what we should do. So this is it is very important when we work in a healthcare system, because to make our management understand what is needed. And when our chairman is he is from the same profession, the communication become more easier and he can understand it. So this is how we make our employees engaged. And this kind of multiple events in this year, we did we expanded it in January or February. We had an event that Kerangure Super League, where we brought in, along with our team, we brought in different departments together. So that was another good memory, because what is satisfying me or us as a team is that when people are enjoying it, and we can, not only from their words, in their feelings, in their expressions, in their face, we can see that they are happy with what we did. This is something always the takeaway of our work. So when it comes to the customer engagement, this is something we started focusing on back in 2015 or 2014, even when Mr. Shanmuga Sundaram joined us, and even before that, because we used to do some customer engagement activity. So we used to, our way of making people engaged is in such a way that, reaching out to the customers in certain occasions like Mother's Day, Women's Day. In these occasions, we always consider our employees as well, because we have women, we have mothers. So when we do something for the customers, we always make sure. Otherwise, your department will tell us that you should make sure. Yes. So we always make sure that our employees also benefited out of this activity. There are certain, one occasion I still remember that one of Mother's Day, we decided to go through the using the our customer data, ladies customers. We identified ladies customers, and we selected certain customers in each pharmacy, and we had different criteria. So one of our area manager who visited her for handing over the gift, even though it was a small thing, but that was an old lady. She was, using walking sticks for walking, and all, that much old. And when we went there for giving this gift, her emotions was, that we cannot explain. Even now, if we ask that area manager, Miss Tina, she will not be able to explain the situation, and that itself is meaning what was that situation.
And
So
I think I can understand, because in the beginning, when you said about working groups, I was just connecting it in my mind that an engaged employee is not someone, who's working in a company that's giving events and parties and gifts and all of those things. Being engaged also means that what they're working, whatever JD that they have, is connected to their own personal values. So I can imagine Miss Tina's, engagement over there when she gave that gift, and how much that customer appreciated that one act must have made her feel that the entire, time she studied B Farm, the entire time she struggled to get the job, the entire time she went through all of that stress was worth it,
yeah.
just to experience that. So
Yes.
I understand that.
So in other occasion that I still remember is that we decided, to recognize the teachers. This was something, a different experience that we had on International Teachers Day. We decided to recognize the day, and we announced through our social media saying that if you're a teacher, visit our pharmacy, you're eligible for getting a gift from the customer. It's not about the what gift we gave, or who came in. It's not the message they passed. This is the first time someone from the community is recognizing them
Not from the
for
school,
their
but from the community.
from the community for their work. The teachers in others way that they are doing the best job. They are creating doctors, all the professionals in the world, and they are creating teachers also. Yes. In these are the some occasions we will identify that in person's emotions are more than business. And when we are taking care of the emotions, the rest of the thing will happen automatically. And we never did it for the purpose of marketing stunt. And you are with we are with you for quite long time.
Yes.
And that how we marketed it. It was all these activities we did on a silent way, and the marketing part was very less. And we identified it as our limitations, and we should do that one. We should announce to the community that we are doing these kind of things. But the feelings that we experienced by doing these activities, that I cannot explain in words. That is a different feeling. uh, like this in recent past, we did an activity during the Ramadan. When we normally people will have promotions and discount sales during the Ramadan, but this year when we think about, we always tell and we always think and tell our team, including area managers, try to do something different, what others are different from what others are doing.
Our core value, creatively unique.
Unique, yes.
Yes. So they came up with a suggestion that let's appreciate kids during this Ramadan, when they, this is a tradition of Qatar or in Arab world to appreciate kids for their involvement in holy month of Ramadan. After 15th, they celebrate Karangao celebration. So there is this set of products we purchased it from the market, and we included it's in a small pouch. We just replicated in the traditional way in pharmacies, and that was we end of the day what we received back is not business. Many smiling faces of small kids, and there are people, kids, they visited the pharmacy in their traditional dress and the happy faces. That's what we care about, because caring your means it's care starts with care. So always our MD says, you should cure from the brain and care from the heart. So we, where whatever we do, there is some influence. So it in one or another way, we are we are automatically connecting with the vision of our chairman. So the other biggest employee engagement activity that we did in recent past is one of the first in the Qatar market that we introduced into the Qatar market, and that was a special event that I think Shabir can explain better, because it involves many regulatory, technical, and marketing parts. This was the one of the biggest marketing campaign we did in Karangio Pharmacy Division.
That was 3W campaign. Actually, it was the first, as I said, that first time in a community pharmacy. So actually, during our meetings and review meetings and with meetings with area managers, always that there will be a suggestion that we can do some raffle draw or lucky draw, but as a management team, that we don't know that how it is possible, because in a pharmacy or with Qatar regulations and all, how it is possible that we can do a raffle draw. And but we, in our discussion, we said that okay, we had different challenges and then we overcome, and then we did it that, but okay, we will try for that. But our first challenge was how we are going to convince with our management. But alhamdulillah, we did that, because even from the management time also, management side also, that for a raffle draw, is it possible in a pharmacy? Because we have at that time, we have 60 plus pharmacies, and then now we are going to do a draw in a pharmacy. The the challenge, it was how to get a approval for that. But we get approval from the management, because we could convince the management, and then they said that just go ahead, and then we'll be with you. But try for that. We can try with that, because that is, as I said, that is the first time in a retail section. So we decided that we will go ahead, and we will try for that approvals, and then we went the MOCA. In initial time, as everyone we knows that one, that raffle draw or lucky draw, how it will be like, we have to print a coupons and then write it and then put it in the box, and then we tried the MOCA, and then they said okay, we can give you an approval, you can go for that, but each branch you have to keep a box, or else you can go for a e-raffle draw if it's possible. So that one, it was very difficult, that one. We cannot keep one box in each.
Imagine every day how many coupons you will get,
Yeah.
and at the end of the time you have to pick and count
Sure.
and all of that.
Yeah, and then as per that Qatar MOCA law, that whenever we are taking a draw, that one of their staff has to come, and in front of them only we can take the draw. So it was very difficult. The challenges again increased. So from their side itself, they said that okay, if you can go for a e-raffle draw, that will be good for us. And then we tried for that one. The next challenge came, that how we are going to do that. So, but alhamdulillah, at that time we had our Care and Cure pharmacy app, online pharmacy app. So we have a good team,
Again, we have to
especially
thank, Mr.
Mr. Sure. No, Mr. Shan, and then
I think this time not Mr. Shan, it was
Oh,
Suhail, and through GM Mujib, Mr. Mujib, he coordinated it through Mr. Suhail in India. I think he is from, he's from Channel, Suhail P.
yeah.
in the
Yes,
future.
yes, yes, yeah.
And actually, that app we have to say thanks to Mr. Shan because we have that
Yeah.
dedicated app.
Yeah, that's what I
That
meant.
yeah,
Thanks
This
to
is,
Shan, we
yeah.
had the applications.
then this raffle draw the team that we had a discussion that Muji sir that he was leading with us because he's really like a techie manager if we if we can say that, and then from his support and then his guidance that we could do everything. As he said that one Mr. Suhail, I think he's in from yeah, they set a system for that. We can do a raffle draw. It was really big change for us because that help us to increase our app downloads and this that our app reaches in the more community because they can order through online and because this 3W campaign in different verticals it helps us to serve more to the community.
So how
That
are
for
you collecting the entries or coupons, and what was the criteria that was set?
actually when we started that one, if those who are buying anything like from our online or offline but worth of 100 riyal, they will get a coupon. Actually, that also in that also they brought a big changes that one. If a customer bought it not only 100 riyal, if a customer bought it 110 riyal or 20 riyal, that if it's accumulated to 100 riyal, they are going to get a
Oh.
coupon. That was a big
So
change
regardless
because
of
in
how much you spend,
yeah,
if you accumulate
hundreds and
that
then they
many
will get
coupons you get.
yeah, and they will get a coupon and it was when well and then at that time actually we have to reach the more community for this one, and then from we have a very dedicated team of area managers. Without them that we cannot reach maximum because you know how they work, like even in front of the pharmacy, even in that busy areas and some community areas, they went directly there and then they convince the customers and then the staffs, yeah, and then they explained it, that how it is, and then from our side also because it was the first time, so we don't want to fail or we don't want to go back that we want to win with wellness. So in that our team had really they supported for this to reach maximum numbers of communities and customers, and then also we have a good dedicated marketing team for that really because you know that one, if we are introducing something especially for the community, it has to reach with
Yes.
special
Everyone has to come to
yeah, sure. So we had a well dedicated marketing team and guidance with Miss Silvana actually, and then Mr. Javas, and then they did really well for that, and then we could reach maximum
Yeah, I
community.
remember the work that was done for the 3W campaign. I think Rafiq also
Yes.
did
Yeah,
very
sure.
Great
Sure.
graphic designing
Yeah.
work. That was absolutely amazing, actually.
That is a good thing we always enjoy because most of the management team of Care and Cure at this stage is grown with us.
Yeah.
So when we started, most all of them started were in the same position
Yes.
how we started, and most of such people are there in the top management level at this point. So for us, for me or Shebi or our area managers team, for them it's an easy, they have an easy access because we have a regular communication out of business with them. So when we are coming up with any one of us is coming up with an activity or a plan, so the entire Karangur will stand with us for the success of it. This is what we experienced during this 3W campaign, because we form a team. The team stood intact until we announced the 3W campaign, and they were instrumental. If we will not, I will not be able to mention a name, but if I mention, I should mention everywhere.
Yeah.
So it's difficult task.
Yeah,
So that is
I'm
the
sure.
the good fortune actually. We are enjoying, because if we are coming with a good plan, with a good cause, and that is a positive and growth oriented, the entire Care and Cure will be with us. So
Yeah,
that
I'm
is
sure. I'm sure. So, when you were talking about getting approvals from MOCI, which is Ministry of Communication and
Minister of Commerce and Industry.
Commerce and Industry, so there are a lot of, I am sure there are a lot of rules and regulations that have changed over the years, even if it is with regards to pharmacy operations or maybe getting your license as a pharmacist. So, has there been that much of a difference? If there has been, then what do a new pharmacy business owner or a new pharmacist who is planning to come to Qatar has to take care? I think you would know better because you are into licensing, right?
Yes.
Tell us.
Actually, when I started in 2009, actually as a pharmacist, when I came that for the pharmacist in Qatar, if those who want to work as a pharmacist in Qatar, we have to have a 3-year experience in any of in their parent country or any of that. It should be 3-year experience, and then we have to write the exam, Qatar qualifying exam, and there will be a viva. But in the overall period, it changes to that MOPH always they are regulating and as per the updating, and it changes to like for the if a pharmacist if a pharmacist want to work as a pharmacist in Qatar, they change it like 2-year experience, that is enough. From the 3 years they reduce to 2 years, and then they I think in 2011 introduced that prometric exam for the Qatar, and there's an online exam. They can write it anywhere from the
So they
not
can write the exam in
yeah
that year.
sure. From outside country also they can write the exam, and then they can come for. And I think now they changed the regulations again
I
in
think it's
2020
called the National Pharmacy
qualifying
Exam.
exam, NPQE. It's they introduced it in 2025. That is it's not a prometric actually. It's a separate exam for a pharmacist in Qatar. But MOPH always they are updating, and they are giving more important for this pharmacist position actually. And that advice what I want to give to as a pharmacist, if those who would like to come here in Qatar, that just before trying to work in Qatar, that just try to get to know that the rules and regulations, and then what is the requirement they needed as a pharmacist. That those who are working, those who completed their course, just try to finish it your 2-year experiences in their home country itself. If you are coming for a coming to work as a pharmacist in Qatar, and it's some company under company visa or something, that it's very difficult, because if you have an experience 2-year experience, then it's easy that you just try to get your experiences with data flow and all, and then it's easy to process it. But if you completed your course and at the same time you are coming to Qatar, it's because nowadays that as per MOPH rule, that those who are in permanent visa or work visa, that they cannot do a training in Qatar. Yeah, those who are under family status or those who are under parent visa, that they can
Okay,
get
so
a
for them it's
yeah
okay.
but for them it's okay. But those who are just complete a course and then suddenly they are coming to Qatar, and then it's very difficult actually. But those who would like to come to here Qatar and to work as a pharmacist, better what I am suggesting, or that you can do your primary evaluation from your home country itself, because you can start a username and password through your QCHP portal, and then you just upload your all required documents, and then you will get a reply that whether if there is any missing or something. So that is better. You can do that one after before you try to get. And but for that licensing procedure, you need a employer for that. So once your primary evaluation, everything is okay, you can come and try for licensing procedures with the help of an employer.
I think when they do the primary evaluation, they can get to know that if there is anything missing, they need more experience, because certain experiences data flow will not consider, and MOPS also will not consider if data flow is not considered. So that if the preliminary evaluation says that you need some more experience, they can complete it and come. Because as he said, if you are in work visa, you will not be able to take training or experience from here in Qatar. So that we might be getting, and I think you also getting. I used to get some calls from the community asking about whether I can work as a trainee. So because people are not aware about the new regulations. Yeah.
Absolutely.
Okay.
And I
So-
think there is another rule about good standing certificate that
Yeah,
we-
good standing certificate before because for the license requirement that is mandatory. Good standing certificate before you have to get the good standing certificate means we have to apply in our home country this pharmacy council, and then that as per our request they will directly send to MOPH. But as per the new rule that the good standing certificate we can request, we can add in our data flow itself. So we can request the data flow team to add a good standing certificate also.
Yeah, that makes sense.
Yeah.
So there's a lot of changes
Yes,
that everyone has to be aware of. So it's always better, I guess, to refer to the DHP website for
Sure,
the
sure,
current
for the
circulars and
certificates.
stuff.
Okay.
Okay, wow. So that's a lot of information that I have got and you have had to listen to. It feels like to me that now I can successfully run a pharmacy business, but I'm sure I can't. I'm not as qualified as you guys. I'm not of the pharmacy background. I have some technical know-how. I was fortunate enough to work with this team for about a year as the quality assurance officer for a while. So that was a very, very great experience because this team captures the whole essence of Care and Cure. I can, on a daily basis, I was able to see how they live by our core values. And when I had to take up the position in the HR department, I was sad to leave them. I almost had tears, but they're in the same office, so we still get to see each other on a daily basis. Anwar, Shabir, I can't thank you enough for joining me here and sharing your journey and insights. It's clear that our management made the right decision of having you in the leadership, and you've done a fantastic job of training your successors as well, the future leaders of this division. And I wish we had more time to hear more from you, but I'm sure all of us have other things to do. We look forward to see more of your leadership in Care and Cure, and we hope that you don't have any plans for your future because Care and Cure definitely needs you.
Thank you so much, and thank you so much for hosting us. Thank
No
you.
worries. So, to our listeners, this was Anwar and Shabir. They have shared their journey from trainees to pharmacists to in charges to area managers and finally to the leadership duo of Care and Cure pharmacies. If you thought pharmacy was just a pharmacy where you went to get medication, we were absolutely wrong because this is what goes inside of the whole picture. So this is Shana Abdurrahman and you have been watching 25 and Beyond. Until next time, see you.